Hey everyone, I'm Dr. Devasai. I'm a Gilstrap Fellow at the CDC Foundation and also an OBGYN in Atlanta. The Gilstrap Fellowship is a fellowship for recent OBGYN resident grads who are interested in getting more experiences in public health as it relates to pregnant people. I'm super excited to talk to you all about our paper coming out in the Green Journal regarding RSV, which is respiratory syncytial virus, and how it affects young children and infants, and our new preventative options that are now available. Now I would like to introduce my co-authors for the paper. We have Dr. Jefferson Jones, who is a pediatrician at the CDC. We have Dr. Dana Mini-Delman, who is an OBGYN at the CDC. And then finally, the senior author of the paper, Dr. Sonia Rasmussen, who is a pediatrician and geneticist at Johns Hopkins University. We're so excited for you all to learn more about RSV on this journey with us, so stay tuned for the upcoming videos for more information. RSV, or respiratory syncytial virus, is a virus that affects young infants or neonates, as well as young children. In fact, about 2 to 3% of babies each year may require hospitalization due to RSV. There are two options available to prevent severe RSV in infants and children. One is a maternal vaccine that's called Abrysvo, made by Pfizer. And it's a vaccine that is given to pregnant people between 32 weeks through 36 weeks of pregnancy. The second option is nirsevimab, which is a monoclonal antibody injection that can be given to infants or young children. Prenatal practitioners and providers are not typically familiar with RSV. I can speak from my own experience that it's not a disease or virus that we encounter frequently in our world with our patients, but one that we know greatly affects our pediatric patients. Given that, this information in our article in the Green Journal coming out this month was meant to provide education on the virus, but additionally on these two new options. There are two options for prevention of severe RSV in infants and young children. One being the maternal vaccine, or Abrysvo, which we give to pregnant people between 32 through 36 weeks gestation. We also recommend giving this vaccine during the September through January months in most jurisdictions. The second option is nirsevimab, which is a monoclonal antibody injection that's given to infants or young children between the months of October through March, again in most jurisdictions. So now it's time to talk about some common questions we've been getting. So number one, can RSV vaccine be given with other vaccinations? The answer is yes, we can. So you can give co-administration of the maternal RSV vaccine with other vaccinations like COVID and flu. Number two, is the vaccine covered by insurance? So if you are a full beneficiary of traditional Medicaid, the vaccine will be covered. Additionally, if you are a pregnant person under the age of 19, you would qualify for Vaccines for Children program. And finally, if you are a beneficiary of private insurance, the vaccine will be covered for you this fall. Number three, is the vaccine or is nirsevimab better? There haven't been any head-to-head trials to show one is better than the other, and both options have been shown to be efficacious. So as of now, we recommend that either option is great for our patients and their children. One of the challenges we experienced this past fall was ensuring access to both of these options for patients across the United States. Another challenge we noted when doing this rollout was that providers, especially prenatal providers, are not as familiar with RSV. So not only were we working to educate our patients about these new options, but also working to make sure that prenatal practitioners felt comfortable and educated on RSV as well. We hope that through these efforts, both by writing the article and speaking with different practitioners across the country, that we can ensure equitable access to both of these options next fall. Also personally, as an OBGYN here in Atlanta, my goal is to make sure that both my patients as well as my fellow practitioners feel like they have the information they need to make sure that their patients can make a decision that they are comfortable with regarding RSV. Thank you, everyone. We made it to the end of this series talking about RSV. I want to leave you with 3 things to think about as we prepare for next season to prevent RSV in the infants and neonates. So number one, I want to make sure that our prenatal providers get in touch with infant providers in their community to make sure they know which options are available for their pregnant folks and their families as we approach next fall. Number two, it's going to be really important to look into how to provide the vaccine at your clinical site or setting. Number three, it's going to be really important to inform your patients early about the options that they have for RSV as we approach next fall. And we're talking early. We're talking to your patients as early as August, since these options will become available as early as September.